Medical's AWV 360 program is a significant asset to your busy practice. Your staff's normal work includes scheduling appointments, making reminder calls, completing the patient encounter and resulting services, providing the audit trail and documentation, and arranging follow-up appointments. The majority of your daily work focuses on patients who are sick. Annual wellness visits require not only the duties normally completed by your staff, but also at least an hour of work prior to the appointment to ensure compliance with Medicare regulations. All of this for patients who are well. Medical created the AWV 360 to complete annual wellness visits efficiently and effectively, a comprehensive solution for profitable, quality preventive medicine. Our work includes all of the steps listed here. Here's what we do. Your time is valuable and already packed with responsibilities. Our work begins with recruiting, hiring, and training the entire wellness team. They are all our employees under contract for you. Each person is specifically trained to provide friendly, competent, compliant service to every patient. We complete annual wellness visits with an on-site, LPN-led team of off-site nurses and technicians. Next, we set up your EMR to ensure that your systems are ready to receive the audit trail information and encounter updating required to verify and bill compliant wellness visits. We handle all of the patient engagement. We take the list of patients in your panel and identify those who are eligible. We send a letter to your patients, which you approve and sign. We pay for the paper, the envelopes, and the postage. Via telephone, we do the entire health risk assessment, or HRA interview, typically 30 to 45 minutes in length. Medical's HRA is comprehensive, covering all the required risk. Each section of the HRA is based upon United States Preventive Services Task Force and/or CDC recommendations for health risk assessment. We schedule all the AWV appointments in your office with our nurse, and we prepare the patients for the counseling for which they qualify. Then we make the reminder calls for the wellness visit. By the time the appointment is scheduled, we've spent 45 minutes to 1 hour with each of your patients. When the patient presents, our wellness nurse completes the face-to-face encounters with patients under your direct supervision. Direct supervision is a legal definition that specifies that as long as the provider is physically available, the provider does not have to participate in the face-to-face encounter. The AWV 360 appointment with the wellness nurse includes alcohol and depression screening and advanced care planning, as well as cardiovascular disease screening for those patients who qualify. We provide a complete audit trail and the documentation to update your EMR in the patient record. At the completion of each annual wellness visit, every patient is required to leave the visit with an individualized personalized preventive plan, or PPP. We put a copy of the PPP into your EMR, and we provide a practice report specific to each patient for billing purposes. Finally, we arrange any follow-up appointments. For example, a patient who needs a colonoscopy will be scheduled with the GI of your preference. Additional services indicated by the AWV may be performed by you or your staff scheduled into your clinic at a later date. Medical provides all aspects of the annual wellness visit for your patients without overhead, training, equipment, or additional personnel. With the AWV 360, you'll receive better, more comprehensive data as well as an updated EMR to reflect the quality preventive services you are providing. In the context of the drive for quality, the AWV 360 delivers better prevention metrics and higher ratings for the coming Physician Compare website from CMS. You'll strengthen your patient relationships and complete preventive counseling. And the PPP and updated EMR provides necessary documentation with an audit trail. All of this while minimizing your accounts payable. We've designed the program so that you are paid up to date each week. You'll receive a certain net income per patient without additional overhead, personnel, or interruptions. The AWV 360 is compliant, comprehensive, and complete. We are the market-leading solution designed to meet and address all of the challenges in the drive to quality. Primary care providers are busy. Let Medical complete annual wellness visits, assisting you to ensure profitable, compliant, quality medicine.